There are some successful results of using EMDR to treat a fear of flying, aerophobia. I was fascinated when I understood that the fear of flying actually has different aspects for different people. For instance, for some people, the idea of being up in the air is terrifying. But for others, the realization that you are stuck in a closed space and you have no control over whether you need to leave the space is unbearable. For some people, the process of plane taking off and shaking gives the terrifying feeling that the plane is falling apart. But for others, the idea of what's happening with an actual dead body is scary. The terrifying aspects are primarily unique, inconsistent for each person, which gives an opportunity to work with them in EMDR to treat the trauma that happened in the past and triggers the unbearable feel of flying in the present. First, we explore the most significant scenario related to fear of flying and use bilateral stimulation to help the person recall the related memories and emotions. By doing that, we can find the core trauma or traumas that have contributed to their fear of flying. What is fascinating is that for some people, this trauma may date back to their pre-verbal life when they were infants and had no active memory of what happened. It's interesting to note that EMDR therapy, we track back memories by using body sensations and emotions to connect with events from the past. Once we have brought traumatic event into the patient's awareness, we move on to reprocessing that trauma until the person is comfortable to fly. The success or stuckness in the progress of treatment, or even the inability to change the fear, from my understanding, depends on various conditions that are unique to each person because our nervous system is complex and multifunctional. For example, we all have maladaptive defense mechanisms that we develop during our lives. We have functional or dysfunctional attachment styles, meaning the way how we build our relationship with others, where other in treatment is your therapist. We're going through different stages of readiness for changes and other factors. If any blockages are found during the treatment, the therapist aims to work through them and address any interruptions. For instance, for EMDR to be effective, the patient must have a strong and trusting relationship with their therapist. For some individuals, bonding with others is an emotional problem that needs to be addressed before effectively using EMDR. Therapy may be a long process for some patients, especially those with significant dissociation defense mechanism, dysfunctional attachment styles, and multiple emotional traumas. However, even a few EMDR sessions could lead to a profound change. Sometimes the significant change happening during just one session.